Complex sleep apnea, CompSAS for short, occurs when previously nonexistent central sleep apnea, or CSA, is triggered by the treatment of obstructive sleep apnea, known as OSA. Keep watching to find out more about CompSAS, its prevalence, causes, risk factors, diagnosis, and treatment. You've taken steps to manage your OSA through continuous airway pressure, known as CPAP. However, as time goes on, that amazing sleep you anticipated continues to elude you. You wake up exhausted, you can't concentrate, and you're fraught with irritability. There's a chance you've developed complex sleep apnea, known as CompSAS. What is CompSAS? There are two types of sleep apnea, OSA and CSA. OSA involves obstruction of the upper airway tract, while CSA occurs when your brain fails to send proper signals to the respiratory muscles that help you breathe. CompSAS is a type of CSA that is also referred to as treatment-emergent central sleep apnea due to its occurring with CPAP therapy for OSA. Studies show that between 3.5 and 19.8% of patients across studies undergoing CPAP titration for OSA develop treatment-emergent central sleep apnea. What causes CompSAS? The causes of the disorder are not fully understood. However, there are a few theories that explain why it happens. CPAP treatment delivers a stream of pressurized air and helps the body remove extra CO2. One theory suggests that the removal of CO2 signals to your brain that you're breathing too much, so it stops sending signals to respiratory muscles. Treatments for other types of OSA, including oral appliances or tracheostomy, can also lead to symptoms of CompSAS. We've covered the causes. Now let's move on into the second half of the video and cover risk factors, diagnosis, and treatment. What are the risk factors for CompSAS? Those of us with heart problems, like congestive heart failure, stroke, and hypertension, are more likely to develop CompSAS. Other risk factors include advanced age, use of opiates, advanced OSA, using higher CPAP pressures, and living at high altitudes. Interestingly, men are at a higher risk of developing the disorder than women. This is due to structural differences in the airway tracts of men and women. One thing to be noted here is that CompSAS is not caused by genetics. If your parents suffer from it, it doesn't mean you will too. How is CompSAS diagnosed? Your doctor will first do a physical examination and take your medical history. You may be required to do a polysomnography. In a polysomnography, you need to stay in a special sleep center overnight where specialists monitor your brain waves, breathing patterns, heart rate, blood oxygen levels, airflow, and muscle activity while you're sleeping. Polysomnography can help diagnose OSA and CompSAS and provides data to help differentiate between the two disorders. What are the treatments for CompSAS? The good news is that up to 2/3 of patients improve within 2 months without treatment. However, there are treatments available. First, high CPAP pressure may be provoking symptoms of CompSAS. If so, you need to adjust the pressure to resolve the problem. In some cases, switching to bilevel positive air pressure or adaptive servoventilation therapy can be effective. With CPAP therapy and no other intervention, CompSAS can resolve on its own. However, it's best to talk with your doctor if you're still experiencing daytime sleepiness after CPAP therapy. Help is available.